Your doctor found a lump on your thyroid. This lump is called a nodule. Many people have thyroid nodules and most of them are not cancer, but doctors need to be sure. They want to check if the nodule is benign, which means it is not harmful. Or they need to see if it is malignant, which means it is cancer. This is a very important step. It helps your doctor decide on the best plan for you. The information from the test guides all future decisions about your health and whether surgery is the right choice for you to consider moving forward. To find out what the nodule is, your doctor will likely suggest a biopsy. This procedure is called a fine needle aspiration, or FNA. During an FNA, the doctor uses a very thin needle. The needle goes into the nodule in your neck to take out a small sample of cells. You might feel a small pinch or some pressure, but it is usually not very painful. The doctor often uses an ultrasound machine at the same time. This machine helps them see the nodule clearly. It ensures they put the needle in the exact right spot to get a good sample for testing. This precision is key to getting accurate results. After the doctor collects the cells, they are sent to a lab. A special doctor called a pathologist looks at the cells under a microscope. The pathologist can tell if the cells look normal or if they look like cancer. The results from the biopsy are very important. They tell your doctor what to do next. If the results are benign, your doctor might just watch the nodule. If the results are unclear or suggest cancer, your doctor will probably talk to you about surgery. This test is the main tool used to avoid unnecessary operations while making sure that dangerous nodules are removed. Sometimes the results of the first biopsy are not clear. The pathologist might say the results are indeterminate or suspicious. This means they cannot be 100% sure if it is cancer or not. When this happens, your doctor might recommend a second biopsy, or they might suggest a special genetic test on the cells from the first sample. This newer type of test can help figure out the risk of cancer more accurately. Getting a clear answer is the goal. It helps you and your doctor feel confident about the decision to either have surgery or to wait and monitor the nodule over time. After your thyroid surgery, which is called a thyroidectomy, you will need time to heal. It is normal to feel some pain and discomfort. Most people describe the pain as a bad sore throat. You might also feel sore in your neck and shoulders. This is because of how you were positioned during the operation. The doctors and nurses will give you medicine to help control the pain. It is important to take this medicine as your doctor tells you. This will help you feel more comfortable as your body begins the healing process. Rest is very important during this initial period to allow your body to recover well. Your recovery timeline will depend on the type of surgery you had. If you had a partial thyroidectomy, where only part of your thyroid was removed, you might go home the same day or the next day. If you had a total thyroidectomy, where the whole gland was removed, you will likely stay in the hospital for 1 or 2 nights. For the first week, you should rest and avoid heavy lifting. Most people can return to a desk job and light activities in about 1 to 2 weeks. It might take 4 to 6 weeks before you feel completely back to your normal energy levels and can resume all physical activities without restriction. During your recovery, you will need to take care of the incision on your neck. The doctor will give you instructions on how to keep it clean and dry. The scar will be red and noticeable at first, but it will fade over time. For many people, the scar becomes a thin, faint line that is hard to see. You should also pay attention to your diet. Eating soft foods like soup, yogurt, and smoothies can be easier if your throat is sore. Drinking plenty of water is also very important. Taking these small steps will make your recovery smoother and more comfortable as you get back on your feet. Your doctor will schedule a follow-up appointment a week or 2 after your surgery. At this visit, they will check your incision and see how you are healing. They will also discuss the final pathology report from the part of the thyroid that was removed. If your entire thyroid was removed, you will need to start taking thyroid hormone replacement medication. This medicine replaces the hormone your thyroid used to make. It is a pill you will take every day for the rest of your life. Finding the right dose can take time, but it is essential for feeling well long-term. Many people wonder if their thyroid nodules can get smaller without surgery. The answer is yes, sometimes this can happen. This is most common with nodules that are filled with fluid, which are called thyroid cysts. These cysts can sometimes shrink or even go away completely on their own. The fluid inside them can be reabsorbed by the body over time. This is a natural process that does not require any specific treatment. Regular monitoring with an ultrasound can show if the cyst is getting smaller, staying the same size, or changing in any other way. It is a hopeful possibility for many patients. For solid nodules, shrinking is less common but still possible. One factor that might influence this is your body's level of thyroid-stimulating hormone, or TSH. TSH is a hormone made by your pituitary gland that tells your thyroid to work. If your TSH level is high, it can sometimes encourage nodules to grow. By treating the underlying cause of the high TSH, such as in early hypothyroidism, and bringing the level back to normal, some nodules might stop growing or even shrink slightly. This is not a guaranteed outcome, but it is a factor that your doctor will consider when managing your thyroid health. Another situation where nodules might shrink is after pregnancy. During pregnancy, hormonal changes can sometimes cause thyroid nodules to appear or grow larger. After the baby is born, hormone levels in the body return to their pre-pregnancy state. This hormonal shift can cause the nodules that grew during pregnancy to shrink back down to their original size. This is a good example of how the body's natural cycles and hormonal balance can directly impact the thyroid gland and the nodules that form on it. Your doctor will monitor these changes carefully in the postpartum period. It is very important to remember that you should not try to shrink a nodule on your own with special diets or supplements without a doctor's guidance. While some nodules can shrink naturally, many do not. The most important thing is to have the nodule properly diagnosed by a doctor, usually with a biopsy, to make sure it is not cancer. If a nodule is benign, your doctor can help you understand the chances of it shrinking and what the best plan is for you, which is often just careful and regular monitoring to watch for any changes over time. After a thyroidectomy, some people experience changes in their voice. This is a potential side effect of the surgery. Your vocal cords are controlled by nerves that run very close to the thyroid gland. During the operation, these nerves can get stretched or bruised. This can make your voice sound hoarse, weak, or breathy. You might also find it harder to hit high notes when you sing. For most people, these voice changes are temporary. Your voice will likely get better on its own over a few weeks or months as the nerves heal. It requires patience as your body recovers from the procedure. In rare cases, the nerve damage can be more significant or even permanent. This is a risk that your surgeon will discuss with you before the operation. If your voice problems do not improve after a few months, your doctor might suggest you see a speech therapist. A speech therapist can teach you exercises to help strengthen your vocal cords and improve your voice quality. They provide special techniques to help you regain control and confidence in your speech. While it is a serious concern, it is important to know that significant long-term voice damage is not a common outcome of thyroid surgery. Surgery is not always the only option for a thyroid nodule. If your biopsy shows that the nodule is benign, not cancer, your doctor might recommend monitoring instead of surgery. This is often called active surveillance or watchful waiting. This approach is very common for small, benign nodules that are not causing any symptoms. Monitoring usually involves getting an ultrasound of your neck every 6 to 18 months. The doctor will check to see if the nodule is growing or changing. If it stays the same size and continues to look benign, you can avoid surgery. The decision to monitor or have surgery is one you will make with your doctor. You should consider several factors. If the nodule is very large, it might cause problems with swallowing or breathing, and surgery might be better even if it is benign. You should also think about your own feelings. Some people feel anxious knowing they have a nodule and prefer to have it removed for peace of mind. Others are happy to avoid an operation if it is not medically necessary. Having an open conversation with your doctor about the risks and benefits of each option will help you make the best choice for your health and well-being.